Dear men, as a doctor, I know that for many of you, a direct phrase like, your size isn't too big, or even just a joke in a group about size if it bothers, you can do the trick. But many don't fully know the real situation. Here's a study that will shock millions of men. When scientists analyzed what 25,000 women actually choose when no one is watching, they found the exact opposite of what culture tells us about women's preferences. I'm Dr. Laura Bennett, a urologist with 15 years specializing in male sexual psychology. What I'm about to share comes from the largest scientific study ever conducted on this topic, research that involves Stanford, UCLA, and Johns Hopkins tracking real behavior rather than asking what people think they should say. The findings destroy every cultural myth about size and reveal why 67% of men are anxious about something that research proves doesn't matter the way they think it does. Hit subscribe for evidence-based men's health content. Drop myth. If you've ever worried about being adequate, you're about to learn why science says you probably are. Stanford researchers realized that asking women about preferences directly wouldn't work because of social pressure. So Dr. Dylan Isaacson's team did something brilliant. They analyzed what 15,000 women actually bought when shopping anonymously online. Their theory: your shopping cart reveals your true preferences better than any survey. They studied purchase data from Amazon and the top 5 adult retailers in America, tracking exactly what dimensions women chose when spending their own money. The shocking result: the average best-selling product measured 6.6 inches long and 5.0 inches around. These dimensions are virtually identical to the actual average male anatomy, according to studies of over 15,000 men, 5.17 inches long and 4.59 inches around. Women weren't buying monster-sized products. They were buying normal. UCLA took this research even further. Instead of surveys or shopping data, they created 33 precise 3D printed models representing the full range of human variation, 4 to 8.5 inches long, 2.5 to 7 inches around. 75 women aged 18 to 65 physically handled these models and selected their ideal sizes for 2 scenarios: casual hookups and serious relationships. Results for long-term boyfriends: 6.3 inches long, 4.8 inches around. For one-night stands, 6.4 inches long, 5.0 inches around. Both preferences cluster around completely average dimensions. Dr. Nicole Prowse, who led the study, noted, despite different ages and relationship experiences, preferences clustered remarkably close to population averages. Here's where everything you think you know gets demolished. Multiple studies asked women directly, what matters more for satisfaction, length or width? The Journal of Sexual Medicine study of 323 women, 87% said width mattered more than length. A college study of 50 sexually active women, 90% prioritized girth over length. Dutch research involving 1,000 women, 77% considered length unimportant or completely unimportant. The anatomy explains why. Rutgers University used MRI scanning to map nerve distribution in vaginal tissue. Dr. Barry Komisaruk discovered that nerve endings concentrate in the outer third of the vaginal canal, the area that responds to circumference, not depth. Most of the vaginal canal contains relatively few nerve endings, making length far less important than girth for sensation. Here's the most important finding: men are massively more worried about size than women actually care about it. Research published in Archives of Sexual Behavior studied 1,482 couples. Only 55% of men were satisfied with their own size, while 85% of their female partners were completely satisfied with their partner's dimensions. Dr. Kristen Mark at University of Kentucky found that when women were asked to rank factors affecting sexual satisfaction, size ranked 11th out of 15 factors. It scored below communication, emotional intimacy, foreplay, attentiveness, stress levels, and relationship quality. The disconnect is enormous. Brain imaging at Northwestern University shows that when men think about sexual performance, their brains activate areas associated with competition and evaluation. When women think about sexual satisfaction, activation occurs in areas related to emotional connection and sensory experience. Men and women are literally thinking about sex differently. Dr. Peter Wright at Indiana University analyzed over 400 hours of mainstream adult content and found systematic size distortion. The average dimensions portrayed exist in less than 5% of the male population, yet they're presented as normal. This creates what psychologists call compare and despair. Men judge themselves against carefully selected, enhanced images that represent extreme statistical outliers. Dr. David Veal's research at King's College London found that men who consume adult entertainment more than twice weekly are 60% more likely to be dissatisfied with their own dimensions, despite being completely normal. Size anxiety often begins in adolescence through locker room comparisons, jokes, and cultural messaging that equates physical dimensions with masculine worth. This anxiety becomes self-reinforcing. Worried men avoid intimacy or become so focused on size that they neglect communication and technique. Market analysis reveals that supersized adult products represent less than 0.2% of total sales, proving that preferences for truly large dimensions are extremely rare. Cross-cultural research shows size anxiety is primarily a Western phenomenon, suggesting cultural rather than biological origins. When University of Minnesota researchers showed anatomical variation data to anxious men, 78% discovered they fell within completely normal ranges and reported significant anxiety reduction. The evolutionary perspective makes sense. Optimal reproductive success occurs when anatomical dimensions are well matched between partners. Average male anatomy evolved to complement average female anatomy. Studies following couples for over 5 years found that relationship satisfaction and sexual frequency were predicted by communication quality, emotional intimacy, and stress management, not physical characteristics. Research consistently shows that factors other than size have far stronger correlations with sexual satisfaction. Communication skills and emotional intimacy top every satisfaction study. Technique and attention to partner feedback matter infinitely more than measurements. Confidence and presence during intimate moments affect partner experience more than any physical attribute. Dr. Barry McCarthy's Good Enough Sex research at American University emphasizes that satisfaction results from overall connection quality rather than perfect performance metrics. For men with persistent size anxiety, cognitive behavioral therapy shows 78% success rates in eliminating size-related concerns within 8 to 12 sessions. The treatment focuses on realistic expectations and challenging distorted thoughts about adequacy. The American Urological Association explicitly does not recommend cosmetic penile procedures due to poor outcomes and significant complication rates. The science is overwhelming. When women have complete freedom to choose any size through anonymous purchasing or scientific testing, they consistently select dimensions that are average or slightly above average. Multiple independent studies involving tens of thousands of participants all reach the same conclusion. Cultural myths about bigger is better are contradicted by actual female behavior and preferences. If you're among the millions of men worried about adequacy, this research should liberate you. According to science, you're likely optimal for the vast majority of women. The energy spent on size anxiety could be better invested in communication, emotional connection, and technique, the factors that actually determine sexual satisfaction. Hit like if this research reduced your anxiety. Subscribe for weekly evidence-based men's health content that separates scientific fact from cultural fiction. Drop comments if these findings changed your perspective. Remember, confidence based on research beats anxiety based on myths every time. Your worth isn't measured in inches. It's measured in your ability to connect, communicate, and care for your partner.